And its morning report. Nurses say their dispute with district health boards is about more than just money. It's about recognition and it's about respect. Nurses have rejected the latest pay offer and a strike is looming in July. Kathleen has worked as a nurse for 8 years. She says the pressures of the job are huge.
We're always missing lunch breaks, on our feet for 8 hours a day, doing shift work. It's exhausting. I work every weekend basically, so I don't have a social life. And I think that's what people are getting fed up with. We get yelled at all the time. I got kicked yesterday. We get abused, and it's just people are just like, actually, no, we need to be recognised for that. Like, we have a degree, we've gone to uni, we have a student loan. We want to live a comfortable life and not be living paycheck to paycheck.
Let's talk to the DHB spokesperson now. Helen Mason is with us. Good morning to you, Helen.
Morning, Guyon.
Is there any more money available?
Guyon, the offer that we've made is already twice our previous offer. The offer now stands at $500 million, which is $250 million more than the last offer. I believe the offer is a really excellent offer. The thing that's really important with this offer is it's about more than basic pay and pay packages. So obviously pay packages are very important to nurses, and we believe that this is a very good deal with an increase for our most experienced nurses, 5 years or more. Over the course of this agreement, they'll have a $10,000 increase in their base pay rates if they're working full-time. But we think there are lots of things in the package which are really important to nurses outside of base pay rates. So that includes the focus on the state safe staffing program, as well as resources to ensure that we actually implement care capacity demand management. That's the extra $48 million that the government's made available, Guyon. The extra 500 nurses, DHBs are really deeply committed to that. DHBs are also very committed to working with NZNO on pay equity. We know that pay equity is a significant concern to our nurses, midwives and healthcare assistants, and who are really highly valued part of our workforce. And so we're looking forward to working with NZNO on pay equity, as well as full implementation of care capacity demand management and safe staffing.
Are there any other key points you want to get out of the way, and then we can perhaps actually answer some questions?
I think the thing that I would say is for nurses to fully understand, and NZNO has made available salary calculator, that we do believe that this is a really excellent offer. I think something that's really important to nurses is nurses having confidence that they can trust DHBs to implement the safer staffing program. The independent panel that made recommendations, DHBs have accepted those recommendations and actually gone further. But within the recommendations are mechanisms for DHBs to be held to account on the implementation of the safe staffing work program.
So that's the safe staffing work program.
Yeah,
okay, can we answer some questions now?
Sure.
Like I ask a question and you actually answer it? Okay, I'll go back to my original question. So you've laid out your case, that's fine. You've had a good amount of time to do that. Is there any more money available?
We believe that the offer...
You've laid it out. We know you say it's fair and it's all great. You've done that.
Yep.
Can you answer the question, please? Is there any more available money?
I think that what we need to think about is the term of this agreement, Guyon, and also the commitment of DHBs to be working with nurses on pay equity. So in terms of more money, we see the conversation and the work that we'll be doing on pay equity as another avenue where potentially we would be looking at changes to what nurses are earning.
So that's it for the money. This is your best offer, money-wise.
In terms of this offer, we believe it's an excellent offer.
I know.
Yeah.
Is there any more money available?
I don't think that the offer now, Guyon, is about more money. I think it's about nurses having trust and confidence that DHBs are going to fully implement care capacity demand management, recruit more nurses. That's what I think nurses are really wanting to know.
Are you able to answer that question or not? Because if you're not, we'll just move on. Is
to
there any more
question,
money available? Yes or no?
Not with this offer.
Okay, thank you. If you are to put a new offer in front of nurses, do you need to get sign-off from the government? I mean, are they negotiating really with you, or is it the government? Who has set this fiscal envelope?
The DHBs made a first offer, and in terms of us being able to make the second offer, I think that was clear to everybody when we came in with the offer that's currently on the table, is that DHBs were able to do that because the Ministry of Health had made available additional funds.
Is this statement true? It's the government that sets the fiscal envelope for this?
I think the government sets the fiscal envelope for New Zealand, Guyon, in terms of health.
So it's the government who set this ceiling?
I think that's a question most probably for the Minister, Guyon.
Well, you surely must know this. Do you have to get sign-off for the dollar figure from the government?
We were able to come back with a second offer because more funding was made available to DHBs.
Okay, I think that's probably
with the first offer, Guyon, DHBs had gone as far as they could go, and the ministry came in and supported DHBs to make an increased offer with this latest offer.
Let's talk about the strikes and what sort of immediate action you can take to mitigate any problems for patients. 2 24-hour strikes planned for the 5th and 12th of July. Are you going to have to withdraw services at DHBs or close some units or take any action of that sort, given you're going to have, 29,000 nurses off work?
So, Guy, the first thing that I'll say is, whilst we are very, very concerned about strike action, I remain hopeful. We have agreed to mediation with NZNO, mediation and facilitation, and so whilst we're planning for the worst, I'm still optimistic that through the mediation process that we'll be able to find resolution, and DHBs are going to be doing absolutely everything we possibly can to reach settlement with NZNO. Having said that, patient safety and staff safety during a strike is of paramount concern to DHBs. If industrial action does go ahead, we will need to defer and reschedule non-essential services. So emergency and essential services will be available. The message that we'd like to get out to our communities, we're very focused on keeping them safe. If people have got urgent... Can I finish I'm
trying to get information for people, okay? So,
and this is what I'm wanting to convey, Guyon. So if there is a strike and people have urgent medical care, then we urge them to still come to hospital or alternatively use emergency services 111. So we'd be strongly encouraging people, if the strike doesn't go ahead, if it does go ahead, please don't, and you've got an urgent medical need, please don't defer coming to the hospital.
Okay, so this is the 5th and 12th of July for people. If they've got emergency care, then they continue as they would normally. But you're saying if they've got non-urgent needs, or that ones that can be rescheduled, they should avoid going to hospital on those days?
And what we'll be doing, Guyon, is that once we get strike notice, we'll be contacting all patients so that they know what's going to happen for them. So if there is any surgery, for example, which is deferred, we'll let patients know what will happen. For patients who are receiving chemotherapy treatments, renal services, we'll be making sure that they've got a really good clear picture of how they're going to receive those essential services. The other thing that I'd say for the general public is to remember about accessing local services through their GPs and through pharmacies, and alternatively accessing Healthline, which is available 24/7. So our primary concern if strike action does go ahead is to keep our community safe. We are very concerned about this, Guy, and we're working really hard.
Thank you for your time this morning. I do appreciate it. It's 7:19.
Now, listening to that was the Nurses Organisation's Industrial Services Manager, Cee Payne. Payne, good morning.
Kia ora, Susie.
You heard there that Helen Mason seems reluctant to say that there was no more money available. Do you expect the ministry to come forward with more funding, considering the outcome of your ballot?
Well, I believe that we will require additional funding to reach a settlement, and I think it's important that the parties do continue to meet and discuss through mediation and facilitation to see if we can find a point of settlement that may be acceptable to our members. The difficulty with the current offer is that it does, and we've acknowledged this, positively increase the number of steps for the RN midwife scale. But it leaves a lot of our members with 3% per annum over 3 years offer from the DHBs. And that has created distortions for our senior nurses, our community health nurses, our enrolled nurses and hospital aides. So there's a lot of our members are standing together. They're feeling very united. This is about patient care. This is about safe patient care in our hospitals. It's not about anything else. And to do that, we have to have a nursing workforce, one that's recognised and valued, one that we can keep in this country, and one that's going to be able to support other health professionals to deliver quality care in New Zealand.
Is there anything else that the DHBs can offer or can do, or is it only money?
Well, I think we need to keep talking too around safe staffing. I think the 2% was a significant step forward in terms of ensuring we've got sufficient staff
and Helen
every day
Mason
in the
was
hospitals.
talking about the safe staffing plan. Do you not trust the DHBs to implement that properly?
I think our problem with CCDM is it will take more time. It's an acute staffing crisis we've got, and that's really the problem. Our nurses are working long hours. DHBs themselves in their hypothetical model had a nurse working on call, had a nurse working overtime, had a nurse working full-time, and had a nurse working unsocial hours, and that was their hypothetical nurse. That's the reality. And it's about time we got more nurses on the floor.
Is that a no, that you don't think that they can implement it the way that you think it should be?
I think we have been working for 10 years to have it implemented properly. We've got some confidence that there is more commitment to it now. But tomorrow, when we wake up, when we've got a signed collective agreement, there is an acute shortage of nurses. And the only way to keep this is 30 years since nurses have got to this point. It's out of frustration. It's out of respect for patients. It's out about wanting to give good care. And it's not about a selfish thing. Nurses wouldn't.
If you've been doing it tough for 30 years, why are you asking for all the money in one shot?
I think the crisis has really developed over the last 10 years, and we've talked about this many times.
But why not discuss it over the last 10 years? Why are you only talking about it now?
We have been discussing it over the last 10 years. It's deepened, and I think there's a point where,
Isn't it because it's a new Labour government and you think you've got a better chance now?
No, I don't think that's what our members are responding to, actually. I just think it's come to a critical point. And I feel for the government because, in a way, they step into these problems. But being the government, you've got to resolve it. Whoever's the government, I think, whoever was government in this term of office would have faced this problem because the problem's been mounting and not addressed.
How big is your mandate on this? What was your turnout in the ballot?
We had a very strong turnout. We don't give exact figures, but this was another historic vote for NZNO, and that was in a very compressed time frame. So a number of people that are standing together around this, and we've heard from our delegates yesterday, they are very clear.
Are you able to give us a general sense?
Was
it a 50% turnout? Was it an 80% turnout? Can you give us a sense?
No, I can't reveal that. We always keep our figures to ourselves. It's very important, but definitely a historic vote for NZNO.
How much of the workforce is unionised?
A very high percentage of the workforce is unionised. 97%, I would say. We're getting close to. We've had over 3,000 members join in the last very short period.
So you have the backing, you have the mandate from your members.
We have a total backing and mandate from our members.
Thank you very much for your time. That is Cee Payne, the New Zealand Nurses Organisation Industrial Services Manager. It's 7:24.
A New Zealander living in Osaka says the magnitude 6 earthquake that killed 3 people in the city was the longest earthquake he's felt in the 10 years he's lived.